The Project. Kuwait. Learn. Live.
Hey guys, welcome to The Project. So for today's episode, Liam and Mahdi are out. They are playing at Spartan races and fitness competitions. So I have asked for a special guest to jump in and join me for a chat about diabetes in Kuwait. The International Diabetes Federation reports that there are 38.7 million adults between the ages of 20 and 79 living with diabetes in the Middle East and North Africa region. Kuwait ranks 7th worldwide for the number of people living with type 2 diabetes. So I'm joined by a researcher from the Dasman Diabetes Institute today to talk about Kuwait's plans to strengthen their prevention and their care through research and data.
All this and more in today's episode.
All right, so go ahead and introduce your name because I'll probably butcher your last name.
No, that's fine.
So, and let me know who you are and what you're doing out here.
Okay, I'm Saad Alsharah, and I would say I'm a GIS consultant, Geographic Information Systems consultant at Dasman Diabetes Institute in Kuwait, and also visiting fellow at University of Canberra. And what we are doing in a nutshell, we are building a GeoHealth lab in Dasman in Kuwait, and to build capacity to do health geography research with specific focus with diabetes. It's a collaborative project between Dasman Diabetes Institute, DDI, and University of Canberra, UC. With the Health Research Institute in UC, we're using their expertise to set up, build capacity, build the infrastructure, do research, and hope to tailor intervention programs in the near future. So
this is mainly type 2 diabetes that we're going after. Okay.
Yeah.
And okay, so that's obviously the most common form that we're dealing with out here. Yeah. So it's doubled from what I've read in the research that I've kind of done in preparing for today. So like diabetes has basically doubled within the last 30 years.
Yeah.
And out here in the Middle East, North Africa region, it's saying 40 million people have diabetes.
Yeah.
And then they're saying that 49% are unaware or undiagnosed.
Yeah.
Can you explain a little bit about that? Of how are they determining that 49% are undiagnosed or unaware, or where, how are they collecting information, I guess, of the census information from around Kuwait and where do those statistics? Can you just talk a little bit? Because I think they sound scary.
I can maybe give a context about Kuwait from that point of view, because my background is in mapping science, geography, and I just joined the Diabetes Institute just last year. So I'm also
diabetes
learning.
Isn't the specific expertise?
Yes, it's not diabetes, but I'm now working with the clinicians, epidemiologists, and I'm giving them that support for mapping science. But I can give you a bit of context about Kuwait, and I think the problem in Kuwait, in a sense, with the rise of the oil and the affluence,
right?
And I think, and that dramatic shift of lifestyle, from eating very what we can call good foods to this introduction of high calorie lifestyle. And it's one of the main drivers in Kuwait for diabetes,
I think everywhere in the world, I think that's the shift. Yeah,
absolutely. And the statistics say that we have about 20% diabetes in Kuwait. Studies say we have more, some certain studies, but about 20%. And most of it is associated with lifestyle.
Yeah.
And the numbers are alarming, they are getting, and now we're coming at a stage where it's becoming really a burden economically to manage diabetes. And I think there is a shift into prevention, and that's what Dasman is trying to do now. We can't keep managing diabetes. It's very expensive to do that. And they're projecting that in the near future, it will really just drain the government, that it cannot keep up with the statistics that how we are going. So now there's a big shift to try to prevent it than intervene, rather than just keep managing it, and that's where GeoHealth wants to come in, to understand the problem holistically, and target these vulnerable groups, and come in early and say, listen, we need to create that.
This is where the attention needs to be focused. Yeah. Okay, so I guess what's your guys' hypothesis with your research? Do you have anything in mind of like where you're going to find
Yep.
most of the problem, or like what's that? Yeah, explain that a little bit.
Okay, so with GeoHealth, what GeoHealth does is, with that spatial component, we call it, so geography links everything together in terms of the GeoHealth lab. Basically, imagine these different layers of data that we bring together. So whether it's socioeconomic status, demography, health data, all the built environment data, road infrastructure, food locations, the type of food outlets,
accessibility,
and all of that. And the thread that knits all of this together is the spatial component. We add geography to that. So we're able to visualize geographically all these different sort of hotspots and different statistics and where they are, and then we try to associate these together and do some inferential analysis and to understand, is there any relationships, happening, and what is causing that? And geography helps you visualize that and identify hotspots, and that way you say you can influence policy to improve that. So, and that is supported by surveys. So when you collect like real data from the people as well, and then you can support that, and then you can say, okay, at this, for example, this block or this suburb, you got this age group that is, being exposed to this kind of food, and you can understand their movement, their accessibility, and with them, you understand why they don't do exercise, why do they eat this food, and then you can try to sort of shift the norm, Once you understand it and you target that space, then you can really tailor the intervention program rather than do a national hit and miss in a sense, the people,
the language to use, who you're speaking to, and exactly what they're getting
what
into.
What does this place need? It needs more maybe walking infrastructure. It needs bike rail.
So in my mind, thinking about that, like I've been in the fitness industry out here for 5 years, and I think of like my clients and then a lot of the, I don't know, just things that I've seen and living here and lifestyle, and I'm just like, this spans across all kinds of demographics, and it's
Absolutely.
rich and poor, and it's so like how, it's everybody. So how do you speak to everybody?
It is yeah. It's interesting because a lot of research in the States and different countries, and in health geography, they see suburbs or neighborhoods with low economic status, they usually they buy more fast food because it's cheaper.
Right. But here
it's the like opposite, which is it's an intellectual challenge because even for researchers coming, we have Australian Canadian researchers working with us. They're like, it's fascinating. It's so different. It
doesn't make sense compared to what they see.
What's in the States, because now you can afford good food here. Usually you can afford good food, like healthy food. Sorry,
right? Fresh food.
Fresh food. You can afford it, but people choose, and I think that's rooted to the culture.
So basically you're asking for an entire like culture behavior shift.
We call it shifting the norms, shifting the social norm. And I think it's challenging, but I think if you work at, with children, you can shift the norm, if you focus, for example, Yarmouk, a suburb in Kuwait, they have this healthy city initiative, so, say you can maybe, drive something with a certain neighborhood or suburb or council that is willing to do that, So this is what we're hoping for. So we're reaching out with our initiative. So we signed MOUs with the Ministry of Health to provide us with data so now we're building the infrastructure, the database to start looking at these relationships. We signed MOUs with the Public Authority for Civil Information because they have all, that civil ID card in Kuwait. So we can map everybody and know, where they live and this and that. And now we are doing a research with the cooperatives in Kuwait. In how Kuwait there's a cooperative, every local suburb has a cooperative.
Yeah.
And the Kuwaitis usually have memberships in their cooperative, so everything they buy, they hit their membership number, and now we can track everything that they buy.
Okay.
So now we can understand their consumption behavior.
Yeah.
So this is only for Kuwaitis, but also but it's a good start for us. To establish that research.
Yeah.
So we're reaching out to the big, the main institutes to bring them together and for this GeoHealth sort of movement, because we can't do it alone.
That's what I was going to ask too, because it's like you're going to come across all kinds of different health information and issues that are going to be attached right next to diabetes. It's going to be obesity, heart disease. There's going to be all kinds of stuff. So like who are you collating all this information with and collaborating with to help?
So we have Ministry of Health,
Okay.
we did the pitch for them and they agreed. So they're officially on board, which is great.
And they've been very
they've been very supportive,
Okay, good,
and we had to, convince them, health data can be a bit touchy, but there's a long-term vision here for the wellness of Kuwait and the people living in Kuwait. We have the civil information, and we signed with the Public Authority for Food and Nutrition.
Okay.
And actually, we're working on a project now because when we went to them and we told them we have this all amazing data about consumption, do you have a food classification system used for Kuwait? So make sense of it. They said no. Do you have a food guideline system for Kuwait? They said no, But then they said, okay, I think we need to do it. And then they raised it up higher. And now we are working with them to establish a food dietary guideline to see if people are adhering to that, So I know it's a bit...
Can you give an example of what that food guideline would be?
So I think Australia has one, Canada, Brazil. So basically it's, I'm not a nutritionist, but it's...
Are you thinking like the food pyramid type thing?
Is that it's a guideline. What's the healthy, at that age, you need to have like 2 apples a day, that amount of protein, that amount of carb. And we don't have that for Kuwait.
Yeah.
And now we have all this amazing data, but also we don't have surveys on... Okay, we have food purchase data, but we don't have consumption. There's no good surveys. There's one survey done by the Kuwait Research Institute, and it was 10 years ago.
Outdated.
And there's a lot of work to be done. But I think right now we're just bringing all these people together, and they're excited. And actually, we're running a Geo health workshop next Monday. Not this one, the Monday after, in a couple of weeks, and it's a free workshop. We did it, and we invited. We had 20 seats. We gave, for example, 2 seats for School of Public Health, Kuwait University. We gave 4 seats to Ministry of Health. A few seats there because we want these people to come together, tell them what GeoHealth is, and then we need to work together. We need nutritionists on board. We need mapping scientists. We need epidemiologists. And to build that sort of expertise together and start doing that research. And then we need to make these intervention programs. We need to influence policy, urban design. We need to, introduce healthy outlets in certain areas, introduce that culture to people. And also, even with the campaigns, I think Australia has many amazing success stories. For example, if a certain suburb, they understand the age groups, the demographics, they understand what people are influenced, and they call the heroes, the right person to do that campaign that can influence that group. Yeah, exactly. Okay. And that works.
Okay.
It absolutely works. But you need to understand this on that scale. You can't do it on the national level anymore.
Yeah.
You need to understand this. And some people may argue, Kuwait is a small country, but you'll be surprised. It's full of variations. It's full of different, you go to a different suburb and it's a different, age group or different sort of
there's a different feel, a different even energy in kind of each little space of it, for sure. That was kind of my biggest concern, with the research was just like, what are you hoping to find, I guess, with it? Because in my mind, I'm just like, it's everybody and it's everywhere. And so what does that look like? And I guess in my mind, any prevention that we've seen out there, it is kind of this global thing. Like my roommate and I were talking about this, and she's from South Africa. And so we were kind of talking about it on like the HIV level. And it's like where information is kind of just blanketly like put out there, but you're not accounting for, a lot of places where kids probably aren't even registered and you don't even know what the population is in the area and things like that. But then where does the funding go? And, and they were finding that when they were giving the funding to a lot of, male leaders in the area, it was being wasted and spent in other places where now they're targeting more the caretakers and the female side and things like that. So I think, with what you're saying with this geo mapping, that you're able to know exactly your audience. So like the plan of attack or the plan of action, I guess, for Kuwait, when you guys are done with this, is going to be a lot of different plans of action. It's not just one single plan of action.
Tailored, it's tailored for certain groups, certain areas, because it's the complex environment that drives this disease. It's not just it's your eating habits, it's your behavior, your culture, your movement. It's a complex problem.
That's the thing. Like for me, when I think of diabetes, that I'm just like, it's a social disease.
It is.
It's who you surround yourself with.
Yeah. And the concept of douanias in Kuwait. And you go to a douania and there's that social pressure. Even if you try to eat healthy, you see everybody around you.
Yep.
And you just you surrender.
Yeah.
And it's it's a complex issue, and I think with the mapping, it makes us identify hotspots.
Yeah.
Okay, it's like a red alert. Okay, this area really need to be targeted. Or here, you need to tailor something different for this area. Here you need to work more on the infrastructure, or you need to work more on introducing whole foods. You need to more on introducing. And if you can do that with policy, if that come at the governmental level, that's where the change can happen.
You need the cooperation there, for sure. Because in my mind, like thinking of, I was just hoping that the plan of action wasn't going to be like, okay, we just need to get like more medication or a hospital or something in this area, because it's like you said, the management side isn't really where the information needs to go. Like, you can give people a pill, you can give them a shot, and like, okay, that's going to suppress like a symptom of some kind, but it's never going to get to the source.
No.
So what you guys are hoping is to provide the information to like, we're getting to the source of this, of like, what is lacking in the area, what are people really struggling
how can
with
really shift the norm to a more healthier lifestyle?
I love that. Yeah.
It's like for us, I remember when I was younger, it was such our lunchbox was a sandwich filled with the Kraft cream cheese.
Yeah.
And that was for my parents, that was okay.
Yeah.
I never had fruit in school.
Yeah.
And this is such a disaster.
Even I worked in the hospitals, even in the States, behavioral health and psychiatric health. So we're talking, schizophrenic, bipolar, depression, all kinds of issues where like diet plays a huge part in that for those people. And these meals that you're getting in a hospital setting, and it's the same thing. It's like no fresh foods of any kind, and it's just bread on bread on bread and carbs, and the people just feel lazy and terrible afterwards. And it's like we're trying to get them in their best mental health and trying to get them active, and you can't do it with that kind of a diet. So the fact that there is no like national guideline or anything like that here is shocking.
And that's with the food, the Authority for Food and Nutrition. And one of their main projects now they're targeting is canteens in schools.
Mm-hmm.
Canteens in schools in Kuwait do not provide healthy food.
Yeah.
And it's hard, and I was talking to the deputy, and she's so passionate about trying to change that, because that's where it starts. When you make it such a norm for them to eat that food, it's hard. Once they grow up, it's hard to go back.
Exactly. I tell my sister that with her kids, and weaning them away from snacks and things like that too. And it's just like, they may push back for a little bit, but once you just make that's the only thing that's available to them. I mean, they're going to, kids are going to eat when they get hungry too. They're not going to starve themselves. Yeah. But, I think when it, like with the education side, with, going in schools and with kids, and you'll find maybe some locations where you think that's where it needs to start.
Where to focus.
So in the fitness industry, where we had started a youth program, Jim, we had, I think I had told you before, Dr. Sanjay Gupta came out to do like obesity and diabetes research like in this area, and he came to Kuwait. But what we found with having that youth location and trying to educate the kids on like moving and healthy eating and that kind of stuff, it was really hard, because at the end of the day, they're going back home to a household that has snacks on snacks on snacks and no really, supervision of it. And then it's, of course, the treat is we're going out for dinner and we're going to order all this food on the table, and we're probably not even going to eat all of it. Yeah. But, you can have all the different fried options that you want and nothing fresh. And so it's like the education really needed to start with the parents or the head of the household, or even just that idea of like, what is a good night out, and kind of that status thing that people might be after here, where it's like going out to eat, like, okay, that's great, it's accessible and you can afford it, but like, what are the better choices that you can be making and still getting that, connection of socializing and going out? Absolutely.
And I think ahead of us in Kuwait, we have a big challenge. It's not going to be easy. It's not going to be easy. I mean, it's like you said, we're going to face a lot of obstacles, even if you target certain groups, you get what is the environment in the house, and it's and that culture in Kuwait, that feast, behavior.
In Australia, okay, because this is where the research is kind of coming from, is based off of a lot of what's done there. So I'm thinking I think I was reading their plan for 2016 to 2020, and it had a lot of focus on like the Aboriginal communities. Yep. And I guess I'm thinking like tradition and culture and things being tight there. Like I imagine that's probably going to be a similar approach to what you're going to find around Kuwait, of how to connect with everyone there. Or how did you find that you're able to shift like what were the problems, I guess, that you're seeing in that community?
Actually, to be honest, I didn't do the research in Australia.
Okay.
Yeah, so
Okay.
it's the expertise of my colleagues, and I'm sort of becoming a facilitator for this research is also new for me, which is
Okay.
also exciting.
Yeah.
So I think I would not be able to answer, because
Yeah.
I haven't had experience working with GeoHealth in Australia.
Okay. Okay.
Yeah. But the guys we're working with, they've been doing GeoHealth for 20 years.
Wow.
Yeah,
Okay.
so they're one of the sort of pioneers, leaders in that field, actually. And one of them, Professor Meg Guthmiller, has developed the first sort of GeoHealth model for Montreal in Canada.
Oh, wow.
Yeah, and I think it was born from there, from the States and Canada. And
Yeah.
he took it to Australia. Australia really, sort of pushed it through. And Dasman realized the importance of it, and that was why we want to work with them. We want to
Okay.
bring that expertise here. So I think they're gonna guide us on how this drives as well. So, yeah. So yeah.
I was gonna say, so you just going back, you studied in Australia for 10 years?
13 years.
13 years you were there. Okay.
Yes.
Is that when, so like growing up obviously on sandwiches and Kraft cheese, like did the health shift for yourself come from once you got out of Kuwait and out of the environment? Or did you grow up, like, did your parents kind of give you a sense of still nutrition and things growing up?
No, I think when I went to Australia and I started discovering myself and understanding myself, because over there you go to the supermarket, you start shopping, and then you handle the food, and then you sort of, it was interesting, I don't know why this didn't happen in Kuwait, because maybe culturally the food is provided in Kuwait. And
I think with my clients, when I'm thinking with getting them, nutrition support is such a detachment from that. Exactly. Like most people are not going and doing the shopping themselves, right? They're not preparing the meal. There's someone else in the house that's doing it.
Absolutely.
And a lot of times I get to, it's like, well, my cook doesn't read English. So even if you provide me English, instructions of things, like they may not understand, exactly what to do with it. So it's like, there's kind of that disconnect between being the one who's actually going, getting the food, preparing the food, doing the things. So I think there's so many interesting challenges that you guys are going to have with the information that's provided. And but I'm excited to see what that is within the household.
And I think that was the turning point. I think when I started buying the food, handling the food, and see how it sits with my body.
Right.
Because you have the time to really reflect and understand
Connect
yourself.
with it. Where did it come from?
And how my body's reacting. And then I started, this doesn't sit well.
Yeah.
And it's sort of, you start to change that, okay. Don't get me wrong. Once in a while, it's nice to have a heavy meal.
Yeah.
But still, you start to understand what sits well. And especially when you handle the food, something about that. And yeah, since then it's just it's changed, and even coming back here, sometimes I struggle, especially with the fresh foods and stuff, and it's hard, It
is harder. It's hard to get a good variety because food has to go through, a lot of the fresh food has to go through a lot to get here.
Exactly.
Seasonally, especially, it's hard to, eat fresh and eat
the
seasonally.
quality is not as good as certain other places.
Yeah.
Sometimes you get good quality stuff, but it depends where you go. But I think, there's a lot of challenges ahead, I must say.
Yeah. So how new or how into the research are, like, when did this start, and what's the timeline?
We started from the 1st of May, 2018, officially. It's a 4-year program, 4-year research. It's 2 phases. It's actually the whole vision is 3 phases, but we signed for phase 1 and 2. For the first 2 years, it's called capacity building. So basically linking up the major institutes, collecting the data set, building the hub. So we're building actually a physical space. We're building a GeoHealth lab. We're doing a diploma in geospatial health. So we want to target certain sort of professionals in the health educators as well, to do geohealth research. So the first 2 years we call it capacity building.
Okay.
So we're getting all the software, bringing all the data sets together, training people, employing. We're going to employ a couple of people to come on board. The second stage is doing the research. So 3rd, 4th year.
Okay.
And after doing the research, the 5th and 6th year is intervention and prevention.
Okay.
So we hope after the 4 years we have enough, to say to them, okay, we need, and we're going to extend the grant to apply it and then take it up to to the government and say, listen, this is what you can do. This is the results. And this is what we did. So we want to apply also for another grant to get 2 more years to maybe do intervention program based on our findings.
Follow through with like
So
exactly
focus
what's
on
put out.
one target, one suburb, maybe on a block, and do it and monitor it and see hopefully the success,
Yeah.
and then take it to the decision makers.
All
So
right.
listen, this is a success story,
Yeah.
and you can implement it. So it's so it's a 4-year project for now, hopefully with extension for the intervention program.
For 6 years.
Yeah,
That's
yeah.
exciting.
Yeah.
Did you get to have a say in them, I guess, like coming to Kuwait, or what was the
Yeah,
connection between the
actually,
university and Kuwait?
I was the link for
Okay.
that, and because when I joined,
You're like, my country back home is a shit show. Come help me.
yeah. It's really cool because when I joined, I was just a consultant part time.
Yeah.
And I just finished my PhD and I just started with them. And then when I went back for my graduation, because it was like 6 months later,
Yeah.
it takes a long time after all that processing with the PhD and everything. And the chief operating officer told me, reach out. I think we have something here. We have more hunger to make this bigger.
Yeah.
I think it's valuable. So I said, okay. So I knew a professor in population health and health geography that was in my same university. So I emailed him. He said, I moved to Canberra, and I was like, Canberra, and I read about him. I spoke to my supervisor. He said, no, these guys are the best. If you want to work with anybody in health and GIS, health mapping, these guys are amazing. So I just booked my ticket. I went there, had just a conversation. We had coffee, spent a few nights in Canberra.
Yeah.
Talked to him. He said, we're keen. Let's do it. Went
Yeah.
back. He said, let's do it. Write up something. Let's start. And from just a conversation to a proposal to a contract to a grant from Ministry of Health.
How long was that process?
It took us 8 months.
Oh, that's a lot quicker than what I was thinking.
It was very quick. I think what stopped us were the lawyers.
Okay. Yeah.
There was all that admin and lawyers from here. The contract kept on going on and off, on and forth. But we got there and we signed, and from 1st of May, we're on.
That's amazing.
And they're coming next week.
Okay.
Yeah, they're coming, Professor Mark Daniel and Associate Professor Neil Coffey. They're coming next week. They're here for 10 days.
Okay.
And we've got meetings with the Ministry of Health. We've got a G-Health workshop we're doing.
Okay.
We've got meetings with all the main people we're working with.
Yeah.
So
amazing.
It's been exciting. Yeah.
Are there any opportunities for any public gatherings or information and things yet that people could be involved with or get to learn more about it, or ways that they can help or anything? Or is this mostly on the research?
It's mostly research. It's mostly research, building the relationships, because they came last year, but now because we're official, and we signed with the Ministry of Health, we want to push that a bit further and say, okay.
So the workshops and things that you're doing are mostly for people within giving the research.
And we were thinking also, I think we might go on radio as well, 99.7, and talk in the morning and stuff, and sort of get that word out there. Yeah.
I'm excited to see what happens with the research and what you guys find. Yeah. Amazing. Any call to action, I guess, for listeners or for just the general public of Kuwait, or things to think about, or what's your...
Yeah, I mean, it's call of action, hopefully, when we have some findings, but it's I think it's what's exciting about this is that we can think about disease from a holistic point of view, and we're going to have a lot of, I think, obstacles. I think a lot of people think, especially, I think, maybe call out to clinicians and medical doctors, to believe in our cause, because, it's for them, it's a disease. I can manage it medically, but I think there's much more to that.
These are the symptoms. They fit in the box. They go with this diagnosis. This is the pill that fixes it.
No, I think it's much more than that.
100%. I'm on board with that as well too.
And we need their support.
Definitely. I think looking at it from less of not necessarily, especially with diabetes, like I said, it's not necessarily a victim of genetics 100%. I think it's mostly the environment that is shaping the people.
Type 2 diabetes especially, so it's your lifestyle. It's your lifestyle.
Definitely. All right. Anything else you want to...
Oh, no, thank you for this opportunity. It's nice to talk about the research,
At least I understand a little bit more. I knew it had the environmental aspect, and I wasn't quite sure on the medical side. And like I said, I'm more on attacking the lifestyle side for people. But I see where this environment information is just going to have a huge impact on knowing exactly how to speak to to each location and knowing what the struggles are of that. I think that's brilliant. So,
and I think it thinks very spatially. That's what G-Help does.
Yeah.
You know, everything very spatially. You know, different areas, different things. You know.
Yeah.
And it's trying to understand it from that point of view will help us to prevent it.
Yeah.
You know.
I love it.
Yeah.
Thank you.
Thank you so much.
Thank you so much.
Thank you for having me.
Bye.
Thanks for listening to this episode. If you enjoyed it, please head over to iTunes to subscribe, rate, and leave a review. You can also find us on Instagram at The Project Kuwait. Thank you, and join us next time.